Okay, we can start the second part of the meeting with the talk of Gianluca Merlo. This part of this presentation introduces the use of functional analysis in school setting and give us an overview of how teacher, expert and operator can interview in school setting. Okay, thank you.
Good morning. My name is Gianluca Merlo and I'm a researcher at Istituto per le Tecnologie Didattiche since 2009. I'm a psychologist, but I'm very passionate in new technologies and I'm pretty expert also in web programming. The topic of my presentation is about the ADHD at school. Why this matter? Students with ADHD have difficulty to sustaining attention to tasks. They play with objects during classes. They call out. Sometimes they are also aggressive. And so, as a consequence, children with ADHD frequently do poorly in school. And they are more likely to have physical problems than other children. They have increased difficulties with peer acceptance, and they are more likely to be anxious or depressed. So the question is how to manage unwanted behaviors at school and at home. You need an action plan. This action plan could be composed by 4 different steps. First of all, you have to identify a target behavior, or many target behaviors, and a desired direction of change. Once a target behavior is defined, you can start a functional assessment, then define a treatment and implement it, and finally you have to evaluate the efficacy of the treatment. But you have to evaluate this efficacy in a statistical manner. So let's see these different points. First of all, as I told you before, you need to identify target behaviors. So this means to define specific behaviors, define these behaviors in details. For instance, yelling could be defined as a vocal utterances above a normal tone of voice, and choice also which is a possible alternate response. So, for instance, in this case, it could be a raise hands or other behaviors. Once target behaviors are defined, it is possible to choose a type of intervention and also to predict which kind of desired modification the treatment could support, could improve, could enhance. Then you have to proceed with functional assessment. What is functional assessment? Functional assessment is defined as the use of multiple assessment strategies in order to delineate specific antecedent and consequent events that set the occasion for and or maintain a target behavior. This approach is very different from the so-called static assessment, because in the static assessment, every behavior, many behaviors look similar, and the way in which you treat a behavior is the same. In the functional assessment, every behavior has a specific function, and every behavior occurs in a specific context. So there are a lot of individual differences between pupils, between students, and obviously every behavior has to be evaluated in details in regard to a function or a context. But which are the most common function of ADHD behavior? The most common function of ADHD behavior are avoid or escape effortful tasks. A second possible function is to gain adult or peer attention. For instance, a frequent consequent event for ADHD behavior in the classroom is a verbal reprimand from the teacher or a non-verbal and verbal reaction from peers. An additional possible function is to assess a reinforcing object or a reinforcing activity that could be not the educational activity, obviously. We have also non-social behaviors. Non-social behaviors are sensory stimulation, like a student that is losing himself in their thoughts, in their pleasantful thoughts. And finally, obviously, there are behaviors that can be aimed to reduce physical discomfort, such as pain. So, how to identify the function of a behavior at school or at home? The most accurate way is the experimental functional analysis. The experimental functional analysis is a protocol defined by Iwata while he was studying self-injurious behavior. This kind of assessment occurs in a very controlled environment in which the experimenter manipulates many different conditions in a random multi-element design. So he manipulates conditions to evaluate which is the behavioral response and to identify the real function of a behavior. Manipulating the behavior, it is possible to generate hypotheses about the function or the functions maintaining a specific unwanted behaviors or unwanted behavior. Obviously, this method is a very good method to infer causation, but this is not feasible at school or at home because it requires very expert practitioners, and you have to also to in some cases you risk to increase the unwanted behavior. So this is obviously not feasible at school or at home. Yeah. Another way to assess the function of a behavior are direct methods. In direct methods, these behaviors are also observed in a natural environment without a direct manipulation of the behavior. These methods have a high ecological validity, but these methods are based only on correlational data. So you observe a behavior in a time, And obviously, if the behavior occurs at low frequencies, you are not able to track this kind of data. Let's see some example of the direct methods. One of the most common direct methods is creating scatter plot. Scatter plots are visual representation of data collected by defining a specific interval and then obtaining information on the frequency and duration of behaviors. So for instance, in this graph, you can see that the unwanted behavior occurs more between 1 o'clock and 3 o'clock. And so you can, this is a clue, because you can formulate a hypothesis about what is happening in that time, in that time interval. Scatter plots are simple to be collected, but obviously you can gather only little information about antecedents and consequences. And so this is just partly feasible at school or at home. A second very common method, direct method, is ABC charts. In ABC charts, the observer collects data on A, the antecedents, B, behaviors, and C, consequences. This is an example of a possible sheet to, that the observer can fill in with data. So as you can see, this is very simple, and obviously this can be used at school from teachers or at home by parents. And you can gather a lot of information about events. So you can connect a behavior with antecedents and consequences. The problem with this kind of method is that it's really time-consuming. You have to spend a lot of time to track a lot of information. And obviously, this kind of information can be contaminated by subjective information. So ABC charts could be improved if there are multiple observers and several contexts of information. But for these reasons, also this method is only partly feasible at school or at home. Then we have indirect methods, where information is gathered by third party, such as parents, caregivers, or teachers. The idea behind this method is that this method not requires a direct observation, so it's easier than direct methods, is less intrusive, because you already know your student and you have not the need to observe the student during the unwanted behavior. And obviously this is usable over a long period of time. Let's see some example. One common indirect method is a functional interview. Functional interview is a tool to collect several variables about a behavior. For instance, the topography, the communication skills of the students, the existence of eventually previous treatment, and so on. This is a list of some functional interview available in literature, but we will concentrate our attention on this one, the functional assessment checklist for teachers and staff. This tool requires just 25 minutes to be completed and consists of two different parts. The part A is aimed to identify problem behaviors, to identify which are the student activities and the associated problem behaviors. Differently, the part B is more focused on the definition of the problem behavior and the definition of setting events, antecedents, and maintaining function. This is a picture of the part A, so the part in which you can gather information about the problem behavior. For instance, in which activity, which frequencies, and so on. And this is an example of the part B. So, for instance, you can see the item and say, what are the events that predict when the problem behavior will occur? So we are working on antecedent of the unwanted behavior. This method is obviously pretty feasible at school, but unfortunately, only a few studies demonstrating its validity from a statistical point of view. Finally, we have indirect methods, including informant-based scales. Informant-based scales are scales providing questions regarding the function of behaviors on a Likert type scales. So these kind of scales have a huge advantage. They can be administered in a really short time and can be scored and interpreted very easily. This is a list of some existing informant-based scales. But at this moment, the most accurate rating scale to infer the function of a behavior is the questions about behavior function by Matson and Vollmer. This scale is designed to aid in determining the function of challenging behaviors by gaining information from informants, such as parents or caregivers. QABF consists of 25 items on a 4-point anchored Likert scale. So never, rarely, some, or often. And QABF items measure 5 subscales: attention, escape, physical, tangible, and non-social behaviors. This is an example of the QABF items. Teachers or parents have to estimate the frequency in which the student engage in many different types of behaviors. For instance, a couple of the items are the student engages in the behavior to get attention, or the student engage in the behavior to escape work or learning situation, and so on. Obviously, these items are related to the factors and dimensions that I told you before. Attention, escape, physical, tangible, and non-social. So at the end, we can have an idea of which is or which are the most maintaining functions for an unwanted behavior. As you can imagine, this is one of the most feasible methods at home or at school. Once we identified the functions related to unwanted behavior, it is possible to plan a treatment and implement it. Obviously, I will run very fast about this issue because my colleagues have already told you previously something about the treatment. So, what kind of treatment? As already you know, the best treatment is multimodal interventions, and it includes social skills training, parent and teachers skills training, behavioral management principles, problem-solving techniques, and also active learning methods. So, after the beginning of a treatment, we have a new problem, because we have to measure the efficacy of our treatment. So, how it is possible to measure the efficacy of a treatment? The answer is, one possible answer is single-case research design. Single-case research design are defined as single-case research design are a diverse and powerful set of procedures useful for demonstrating causal relations among clinical phenomena. The basic design to assess a single case is a single-case treatment is the AB design, where several times outcomes is measured both in A, the baseline, and B, the treatment. Obviously, there are more complex designs, such as ABA, ABAB, but the logic behind this method is the same that I will describe later. In NAD-AB design, a single case has three different effects. As you can see in the first picture, this is the effect of time on the general trend. So, in this case, this shape that we can see in the graph is just the natural shape of that behavior in the time. Then we have to consider that in a single case design there's also an effect of the treatment on the outcome levels, because obviously if our treatment is working, we can observe some behavioral change. And finally, we have also an effect of the treatment on the outcome slopes. As I told you before, these three effects exist simultaneously in a single case design. So we need a way to disentangle the role of each factors involved in a single case design. And how could be possible to disentangle the contribution of each factor? The most probably widely used technique used in the past are visual inspections. but several studies have questioned the efficacy of just the visual inspection. Because it is possible to easily make mistakes about the efficacy of a treatment. So we need also to use robust statistical indexes. Let me show an example. So in this case, we can see in this graph, the unwanted behavior seems to increase during the treatment. So we could conclude that the treatment is not working, just using visual analysis. But if we use a supported visual analysis, and at the same time we use robust statistical indexes, the result of the efficacy of our treatment is totally different. Because as you can see, the new graph, the trended graph, show that the unwanted behavior, the gray line, is decreasing. And when we apply, when we measure the effect size with the Ellison D, we can observe that the result, minus 1.32, is a large negative effect. So the treatment was effective. And so to conclude this issue, our answer about how it is possible to disentangle each factor involved in a single case design and knowing if really our treatment is effective or not, one of the most accurate way is using an assisted visual representation and robust statistical indexes. So, how the one project will support this kind of process? The one project will support teachers, parents, and ADHD experts to join in a network using a web application both for mobile devices and for desktop computers. And this web application will provide users with a lot of features, such as features to track observed behaviors, features to perform a functional assessment, features to plan, exploiting the expertise of ADHD experts involved, to plan a school or home treatment, and at the end, feature to evaluate using the supported visual analysis and robust statistical indexes to evaluate if our treatment is effective or not. Unfortunately, you have to wait another year to try this kind of application because our project is started just today, so you have to wait. Thank you very much.
Thank you, Gianluca, for giving us this overview about the functional analysis and the possible application in school setting. There are questions about this presentation? Okay, thank you. Yes, a question. How and when is it possible to disseminate this application at school?
I think in the middle of 2014. So you have to wait a year, more or less. And we will provide the teachers and parents of ADHD pupils with training courses to improve the teachers and parents' skill to observe unwanted behavior according to this approach, and also to use this kind of application with mobile devices and desktop computers. Obviously, this application will be translated in 4 languages: English, Italian, Greek, and Portuguese.
Okay, other questions? No. Yes. Okay, there is a dissemination plan for disseminate this application at school?
Yeah, at this moment we are defining the dissemination plan because the project started just in these days. So, but obviously there will be a lot of communication channels to be informed via social network, via mailing lists, and obviously we will contact also directly schools to inform you about the state of the project and the new events and the results.
Okay, other questions? Okay, thank you.